Children can get sick or hurt at any time, and as a busy parent, you want to make sure you are making the right decision right away. When your doctor's office is not open, should you go to the emergency department or to urgent care? Making the best choice will depend on what's wrong with your child.
First of all, if you are in a situation where your child is hurt badly, bleeding heavily, having trouble breathing, or has a life-threatening injury, call 911 immediately. For other illnesses or injuries, call your child's doctor, and he or she can guide you to make the right choice. They may direct you to the emergency department or to the urgent care, or advise you to wait until the next day to see your family physician.
At urgent care, we treat routine sickness and injuries, the type of things your doctor would see in his or her office. You should bring your child to urgent care if they have a cough or cold, a sore throat, if you think they have a minor infection such as ear infection, strep throat, or the flu, rash or bumps, a sprain, a minor burn, if your child suffers from asthma and has mild wheezing, if your child is throwing up or has diarrhea but is not dehydrated, or if your child is running a fever and they are over 2 months old. You should bring your child to urgent care if they have a minor cut or injury or a minor head injury without loss of consciousness.
At the emergency department, we treat serious illness and injuries. You should bring your child to the emergency department if they have had a serious trauma, such as injuries from a car crash, bleeding that won't stop, or a serious laceration. Has a broken bone or an eye injury? If your child has fallen from a high place or has a major head injury and is vomiting or not acting right. You should also bring your child to the emergency department if they have a serious illness, such as a serious infection, problems breathing, has had a seizure. If your child is under 2 months of age and running a fever, your child is dehydrated, or is in any major pain.
You should also bring your child to urgent care when told to do so by your child's doctor.
And if your doctor tells you to bring them to the emergency department, then that is what you should do.
Whether you visit urgent care or the emergency department, you need to bring along your health insurance card, your photo ID, a consent to treat form if the child is being brought in by someone other than their legal guardian, a list of your child's medicines, any allergies they may have, and their health history. This is especially important if your child has a medical condition that requires medication, such as asthma or a long-term illness.
When you arrive in the emergency department, your child will be evaluated by an experienced ED nurse. You may have a slight wait as the ED team attends to the sickest children. While you are waiting, if you think your child is getting sicker, please notify the ED nurse.